Nursing was always something that I thought I wanted to do. My mother is a nurse. I enjoy the health field. I always knew I wanted to do something in the health field. So after several years of working with other nurses, doing my job in public health, I felt I really wanted to do something more hands-on. So I decided to go back and actually follow that little voice in the back of my head that kept saying, go ahead and do nursing.
I just love taking care of people. That's just who I am.
Don't come into nursing because you want, that job security, you want that paycheck. Come into it because it's something that you really love to do. You need to be a caring person because some days going to work, you're going to have patients that are going to push your little button, and no matter how hard you try to be nice to them, but you need to have a caring heart to truly do nursing.
At the hospitals, I met so many amazing people that I got to take care of. And then some of the community experiences I had. I got to work at daycares and stuff. That was awesome too.
It would probably be the patients. Knowing, I didn't expect as a student nurse for them to be so appreciative of my care. And knowing that every day when I would go and say goodbye to them, they would be like, oh, thank you for helping me so much. Am I going to see you again? Some people asked, if I was going to be their nurse the next day. So it was just a humbling experience to know that, I did make a difference.
I feel like I'm about as prepared as I'm going to be. If I would have done 4 years or 1 year, I don't think anyone's really prepared to jump in that first year and you kind of learn as you go. It's kind of scary and exciting. I think a lot of nursing you learn by doing. So they gave us the tools as far as information goes, science knowledge, this does this, look for this. But I think the real learning is going to happen once we finally get into our job.
Apart from the theoretical aspect that we do in school and then the technology part that we also do in the lab, we have the opportunity to get in the community to get us prepared for what is really ahead of us.
I feel like it's prepared me. I mean, just in my clinical experiences, I'm precepting right now, and I find myself answering questions that my preceptor doesn't know the answer to just because, it's fresh still. So, I mean, I know the knowledge is there.
I've heard great things about Duquesne, just with their faculty and their experience.
I mean, every time I go to a hospital and they ask what school I'm in, they find out I'm in Duquesne, like, oh, it's such a great school, my niece is there, or, my son's going to that, blah, blah, blah. So, I mean, it's got recognition, which I like.
Actually, I looked at Duquesne and saw that it was actually a good fit for me. I pretty much had all the prerequisites done. The time frame of the 12-month program, it fit into, okay, I was able to save up money for a year.
I think Duquesne kind of offered a more intimate class setting, which I really appreciated.
As I always tell my daughter, I think the School of Nursing at Duquesne has that human, personal touch, and that is what attracted me to Duquesne.